We are the Association for Child and Adolescent Mental Health, or ACAM for short, and this is ACAM Learn.
Postnatal depression is a serious mental health issue that affects about 10 to 15% of women in the first year after giving birth. There is a consistent evidence showing that untreated postnatal depression can have long-lasting negative consequences on mothers, such as persistent depression and a high risk of future recurrence, and even increased self-harm or suicide risk. In addition to those, depression can also make bonding with their children more challenging and strain the relationship with their partners. But it is not just the mothers who are affected. Children of mothers with postnatal depression also face higher risk of having developmental delays or difficulties, whether it's physical, cognitive, or psychological. And they're also more prone to mental health issues like anxiety and depression. Some of those negative associations can still be observed when the child reaches teenage years. So given all these evidence on the negative impacts of untreated postnatal depression, it is clear that timely intervention make a big difference and help avoid many of these negative consequences. So as we all agree, prompt and adequate treatment for postnatal depression is essential. In general, treatment options include self-help, talking therapies like cognitive behavioral therapies, and medication. And the choice of treatment generally depends on the severity of the depression, patient's preferences, and their history with mental illness and previous treatments. For example, mild cases may benefit from self-help strategies or talking therapies, while antidepressants are often offered to cases like more severe depression. So selective serotonin reuptake inhibitors, SSRI, are a commonly used medication for depression, as they are well tolerated and they are effective. And SSRI works by increasing the level of serotonin in our brain, which helps improve mood. And studies have shown significant improvement in postnatal depression symptoms with SSRI treatment compared to placebo. In our study, we observed similar positive effects of SSRI treatment for postnatal depression. We followed families from pregnancy through the first 5 years after childbirth, and we found that postnatal SSRI treatment not only reduced long-term maternal depression, but it also improved emotional and behavioral problems of the child. Although we did not directly investigate the mechanisms, it is possible that the improved maternal mood strengthened mother-child bonding and promote more positive parenting, which could contribute to the benefits that we observed. And in fact, improved mother-child interaction was found to be a key factor associated with better child developmental outcomes in previous studies. This is an important question because understanding patterns of treatment use, beliefs, and preferences can help us directly address barriers that prevent women with postnatal depression from accessing appropriate care. But unfortunately, there's very limited research on this topic. And studies in the US have shown that many women with perinatal depression actually feel more confident in getting advice from friends or families or in talking therapies than in medication. And the common barriers that's been reported are limited accessibility to healthcare professionals, lack of information on best treatment options, and uncertainty about the benefits and risk of medications. And in the UK, there's one study interviewed women participating in a clinical trial for postnatal depression treatment. And they found that initially, most women actually had a skeptical view towards SSRI, but through interaction with healthcare professionals and with other patients, their perspectives often shifted. And that study also found that women who took antidepressant in the trial reported benefits like mood stabilization and regaining the energy to manage daily activities and a sense of normality. These studies highlight two main barriers. One is structural challenges, and the other is a lack of knowledge. So, to address these, understanding the lived experience of patients is crucial, specifically what they find challenging and what support they deem most helpful. And clinicians should explore each patient's specific concerns about treatment and provide psychoeducation on the cause of postnatal depression to reduce stigma and clearly explain treatment options including their risk and benefits. And in addition, like regular follow-ups are vital to strengthening continuity of care and building a strong therapeutic alliance, which are essential for promoting treatment adherence and better outcomes. The findings on the safety of perinatal SSRI use for children are mixed. But it is worth noting that infant exposure to SSRI through breast milk is generally low. But we still have to bear in mind there have been some case reports of potential side effects in infants from SSRI exposure through breast milk, with symptoms like agitation, restlessness, and feeding difficulties. However, these symptoms are generally transient and manageable. A Cochrane review on SSRI use for postnatal depression in 2021 found none of the studies they included for review reported adverse event intrusion. But the author also acknowledged that data on long-term child-related outcomes are very limited. And we recognize that the limited evidence on this topic may contribute to some treatment hesitation. So to address this, our study followed children from birth to 5 years old, examining their emotional, behavioral, motor, and language development. And we found no evidence that postnatal SSRI use had a negative impact on these outcomes. Of course, our study has its limitations, so it is essential for clinicians to weigh the risk and benefits of different treatment options for each individual. Our study adds valuable insight to the mixed finding on the safety of perinatal SSRI use for children. Many earlier studies on postnatal SSRI use and child-related outcomes have been limited by small sample sizes and the lack of long-term follow-up. One of our study's main strengths is its large sample size. We had over 60,000 mother-child pairs in Norway, and the fact that we followed the children up to 5 years of age. So this scope allowed us to address some of the limitations of previous research. Second, another challenge in this area of research is confounding, like socioeconomic status, which might influence both a mother's likelihood of receiving SSRI for her depression and the child's outcomes. Although randomized controlled trials would ideally minimize these biases, they aren't always ethical in this context. So to strengthen our finding, we use a method called propensity score matching, which helps control for personal and environmental factors to better approximate a randomized design. This approach allowed us to make more confident conclusion with less risk of bias. Additionally, we repeated our analysis in women with more severe depression and control for prenatal SSRI use, and our findings remain consistent across these tests. Overall, our study helps advance the understanding by providing a more robust look at long-term child outcomes following postnatal SSRI use. There is still a lot of work to be done in this area. For instance, our findings may not be directly transferable to other countries, so replication studies are important. Also, we did not compare the effects of different types of SSRIs or other classes of antidepressants. which can be valuable information for clinicians and for patients. And lastly, the mechanism behind the positive effects of treatment are still unclear. If we can better understand these pathways, it could open up more options for targeting and preventing these long-lasting negative outcomes.